Theraflu is a combination medication used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. It helps relieve stuffy nose, sinus, and ear congestion symptoms, as well as watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It contains acetaminophen, APAP, as a pain reliever and fever reducer. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It's best to consult with a doctor or pharmacist for more details on using this product safely. Theraflu does not cure or shorten the length of the common cold and may cause serious side effects, so it's important to carefully follow all dosage directions and not use the product to make a child sleepy. Avoid giving other cough and cold medication that might contain the same or similar ingredients, and consider other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. When taking Theraflu, it's important to carefully follow the directions on the package label if you're using the over-the-counter version. If your doctor has prescribed it for you, follow their instructions. If you have any questions, consult your doctor or pharmacist. You can take Theraflu by mouth with or without food, but if you experience stomach upset, taking it with food or milk may help. It's also important to drink plenty of fluids when using Theraflu, as this can help loosen the mucus in your lungs. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device and shake the bottle well before each dose. If you're taking the extended-release capsules, swallow them whole and do not crush or chew them. The dosage will vary based on your age, medical condition, and response to treatment, so it's important not to increase your dose or take it more often than directed. If your condition lasts for more than 1 week, gets worse, or occurs with other symptoms like a persistent headache, rash, or fever, be sure to contact your doctor. Always check the specific package label for when to contact your doctor. Some common side effects of Theraflu include drowsiness, dizziness, blurred vision, upset stomach, nausea, nervousness, or dry mouth/nose/throat. If any of these effects persist or worsen, contact your doctor or pharmacist immediately. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks for you. Many people using this medication do not experience serious side effects. Seek immediate medical attention if you experience any serious side effects, such as changes in mental/mood, such as confusion, hallucinations, shaking, difficulty urinating, fast/slow/irregular heartbeat, or seizures. While rare, a very serious allergic reaction to this drug may occur. Get medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed, contact your doctor or pharmacist. In the US and Canada, call your doctor for medical advice about side effects. You may also report side effects to the respective health authorities. Theraflu contains acetaminophen, which can cause liver disease if taken in large amounts. Adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen per day. People with liver issues and children should take less. Make sure to check all medication labels for acetaminophen and ask your pharmacist if you are unsure. Do not consume alcohol while taking Theraflu as it may harm your liver. If you believe you have taken too much acetaminophen, seek medical help immediately. Symptoms of an overdose include nausea, vomiting, loss of appetite, sweating, stomach pain, fatigue, yellowing of the skin, and dark urine. Before taking Theraflu, make sure to inform your doctor or pharmacist if you are allergic to any of its ingredients. It's also important to consult with them if you have any health problems such as breathing issues, diabetes, heart problems, high blood pressure, kidney or liver disease, seizures, stomach or intestinal problems, overactive thyroid, urination problems, or if you are pregnant or breastfeeding. Theraflu may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing any activities that require alertness or clear vision until you can do so safely. It's also advised to avoid alcoholic beverages and to talk to your doctor if you are using marijuana. Some brands of Theraflu may contain sugar, alcohol, or aspartame, so if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, make sure to ask your doctor or pharmacist about using this product safely. It's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products before having surgery. Children and older adults may be more sensitive to the side effects of Theraflu, so it's important to be cautious when using this medication in these age groups. And for pregnant women or those who are breastfeeding, it's crucial to discuss the risks and benefits with your doctor before using Theraflu. It's important to be aware that Theraflu can interact with other medications, potentially changing how they work or increasing the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. There are certain products that may interact with Theraflu, such as ketoconazole and levoketoconazole. Taking MAO inhibitors with this medication can cause a serious and possibly fatal drug interaction, so it's important to avoid taking MAO inhibitors during treatment with Theraflu. Make sure to ask your doctor when to start or stop taking this medication if you are also taking MAO inhibitors. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Additionally, the ingredients in Theraflu are available in many prescription and non-prescription products, so make sure to check the labels on all your medicines to avoid any potential interactions or increased side effects. Furthermore, do not use Theraflu with any other antihistamines applied to the skin, as this may lead to increased side effects. Lastly, this medication may interfere with certain lab tests, possibly causing false test results, so make sure to inform lab personnel and all your doctors that you are using Theraflu. If someone has taken too much Theraflu and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canadian residents, call a provincial poison control center. Symptoms of an overdose can include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes or skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Remember to keep Theraflu out of the reach of children and use it only as directed. Be sure to attend all scheduled medical and laboratory appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to keep track of your health and follow up with your doctor as recommended. If you are using this medication regularly and happen to miss a dose, take it as soon as you remember. If it's close to your next scheduled dose, just skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. When it comes to storing Theraflu, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, and definitely don't freeze the liquid forms. It's crucial to keep all medications out of reach of children and pets. When it comes to getting rid of Theraflu, don't flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, make sure to properly discard the product once it's expired or no longer needed. If you're unsure about the best way to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.